In this video, we'll discuss about uses of enzyme. Enzymes are divided into two main groups. First one is plasma specific or plasma functional enzyme. The concentration of these enzymes are more. Concentration is more in the plasma. They are functional in plasma. Example, clotting factors and lipoprotein. It is important in the plasma. These two groups of enzyme are not useful in diagnostic use in the enzyme. So these two are not used for diagnosis. Second one is another group of enzyme which is very important, that is a plasma non-functional. This one is the plasma specific, this one is plasma non-functional. This one is non-specific and a non-functional group. It is important. The concentration of this enzyme is low in plasma. They are non-functional in plasma. The concentration is important. They are present in cell at low concentration, but it is higher than the plasma. But whenever there is proliferation, necrosis, damage to the cell or neoplasm, the concentration will increase. The concentration of this enzyme increased. They lift out in the cell plasma. Now, the concentration of plasma is increased. Now, these enzymes are useful for diagnosis for various diseases which are useful in diagnosis, so which are called diagnostic use of enzyme. So whenever that cell proliferation, cell damage or neoplasm, that time that concentration will increase. They lift out in the cell. The concentration of plasma increases. Now that enzyme useful for diagnosis of various diseases. So now we will discuss diagnostic use of enzyme. There are many enzymes which are used in diagnosis of various diseases. First important one is a liver disease. These enzymes which are useful for the diagnosis of liver disease. So what are the enzymes? First one is alanine aminotransferase. ALT, it is also called as serum glutamic pyruvic transferase, SGPT. ALT is also called as SGPT, that normal level 10 to 40 international unit per liter. Then aspartate aminotransferase, AST, it is also called as serum glutamic oxaloacetic transaminase, SGOT, normal level 8 to 20 international unit per liter. Then alkaline phosphatase, ALP, normal range 44 to 147 international unit per liter. Then 5' nucleotidase, normal range 2 to 17 unit per liter. Then gamma glutamyl transferase, GGT, normal range 5 to 40 unit per liter. These are the important enzymes used for diagnosis of liver disease. ALT is more specific for this ALT is more specific for liver disease as comparing to AST, because the concentration of ALT only increases in liver disease. That's why it is more specific. That ratio of AST and ALD is known as de-Ritis ratio. The ratio of AST and ALD is less than 1% indicate liver disease, cirrhosis of liver. More than 2, it indicate alcoholic liver disease. If ALT level increases marked elevation, it is viral hepatitis. Now coming to ALP, alkaline phosphatase, it is a marker of obstructive liver disease. There is increase 2 to 3 percentage indicate viral hepatitis. 10 to 12 percentage indicate obstructive liver disease, but it is more than 25 times normal. In the malignancy tumor, there is bone involvement, Rickets Packett's disease in bone and neoplasm. If there is AST and ALD level slightly increase and mass increases of ALP, these indicate obstructive jaundice. Mass increases of AST and ALT and slightly increases of ALP indicate hepatitis. The LDH4, lactate dehydrogenase 4 and 5, increase in liver disease. So these are the important enzyme indicate liver diseases. Now coming to next organ, heart. This is also known as cardiac marker. The enzyme include that creatine kinase myocardial band, CPK or CKMP. It is important in myocardial infarctions. The earliest enzyme, this one is the earliest enzyme to rise myocardial infarction. It started rising in 4 to 6 hours after the attack, which is peak in 24 hours and return to normal 2 to 3 days. It is also a marker of reinfraction. It is also a marker of reinfraction. Other markers are lactate dehydrogenase. It is specific for heart, and aspartate amino transferase, AST. These are the important marker used in heart. CKMP, lactate dehydrogenase, aspartate amino transferase. Then other markers like protein act as a marker, myoglobin, troponin, ischemic modified albumin, glycogen phosphorylase, pregnancy associated plasma protein A also act as a myocardial infarction marker. So what are the other marker? Myoglobin, troponin, ischemic modified albumin, glycogen phosphorylase, pregnancy associated plasma protein A. So marker for heart disease, creatine kinase myocardial band, CKMP, lactate dehydrogenase, aspartate amino transferase, then protein marker, myoglobin, troponin, ischemic modified albumin, glycogen phosphorylase, pregnancy associated plasma protein A. These are the important markers for heart disease. Third marker, pancreatic disease. Marker for pancreatic disease. Enzyme which level increases in pancreatic disease. First one is amylase. It is important marker but non-specific because the concentration also increase. Amylase, the salivary gland infection also leads to increase the amylase level. Also abnormal condition, various tumor and neoplasm also increases this amylase level. Next, the most specific in the lipase. And comparing to amylase, lipase is specific for pancreatic disease. So marker for pancreatic disease, amylase and lipase. Next one, bone disease. Marker for bone disease. Alkaline phosphatase and calcitonin is important marker for bone diseases. There are 6 enzymes of alkaline phosphatase. So 6 enzyme of alkaline phosphatase: alpha 1, alpha 2 heat liable, alpha 2 heat stable, free beta, gamma, and leukocytes alkaline phosphatase. So these are 6 important enzyme of alkaline phosphatase. This free beta, this one, the concentration of free beta increase in bone disease. Reagan, it is placental variant. It is similar to placental that alpha 2 heat stable. The concentration is increases in the carcinoma of liver, lungs and gut. There is increase in Reagan isoenzyme. It is similar to placental variant. Therapeutic uses of enzyme asparginase. It is used in acute lymphoblastic leukemia. Asparginase used for acute lymphoblastic leukemia. Second enzyme streptokinase. Third one is urokinase. They are used in clot lysis, used in myocardial infarction, cerebral infarction, DVDT, venous thrombosis, and CVE, cerebrovascular episode. They are thrombolytic agent, lysis of clot. Then streptodornase. It is a DNA enzyme used for local applications. Next, papain. Papain. It is anti-inflammatory agent. Then alpha 1 antitrypsin used in emphysema. Then RTPA, recombinant tissue plasmalogen activator, used for lysis, clot in myocardial infarction and cerebrovascular episode. Then 8th one, pancreatin. Pancreatin, it is used for digestive disorder or diseases. So therapeutic uses of enzyme, totally 8 enzyme: asparginase, streptokinase, urokinase, streptodornase, papain, alpha antitrypsin, RTPA, recombinant tissue plasmalogen activator, and pancreatin. Asparginase mechanism of action: it utilizes aspargine. Tumor cell use aspargine as a substrate. So asparginase utilize aspargine, decrease the level of aspargine and inhibit the cell growth. That's why it is used in acute lymphoblastic leukemia. So these are the therapeutic uses of enzyme. Mechanism of action: it utilizes aspargine. Tumor cell uses aspargine as a substrate. So asparginase utilizes aspargine, decrease the level of aspargine that inhibits cell growth. That's why it is used in acute lymphoblastic leukemia. These are the therapeutic uses of enzyme. Last, laboratory uses of enzyme. In laboratory estimation, example, glucose estimation, hexokinase, glucooxidase, peroxidase enzyme used. Then urea estimation, urease used for estimation of urea. Then uric acid, uricase used for estimation of uric acid. Then cholesterol, that cholesterol oxidase and peroxidase used for cholesterol estimation. Triglyceride estimation, we are using lipase. In laboratory uses in ELISA technique, we use horse radish peroxidase alkaline phosphatase in ELISA. Then recombinant DNA technology, we can use polymerase, tag polymerase in PCR. Then used restriction endonuclease used for DNA polymerase then or DNA technology. Restriction fragment length polymerization RFLB used restriction endonuclease and DNA polymerase. So these are the enzyme used in laboratory. Lab uses enzyme are used for diagnosis of diseases. Thanks for watching.